A patient has been diagnosed with coronavirus in Scotland. The patient lives in the Tayside area and has recently travelled from Italy. Following a positive test result for the virus, they are being admitted to hospital and are currently receiving treatment in isolation. Clinicians have already begun contact tracing, the process of gathering details of the places they have visited and the people they have been in contact with since returning to the UK. Earlier it was announced that Scotland is introducing testing amongst patients with flu-like symptoms to help prevent the spread of coronavirus, as 12 more British patients tested positive. The Scottish Government said it was important to note that the first Scots case does not involve people the patient may have passed on the street or in a shop, as the risk in these situations is very low. First Minister Nicola Sturgeon has chaired a meeting of the Scottish Government Resilience Committee, SCORE, this evening and will be taking part in the UK Government's Resilience (COBR) meeting chaired by the Prime Minister tomorrow morning to ensure all necessary steps are being taken to prepare for further expected cases in Scotland. SCORE will meet again later tomorrow. There have been a total of 698 negative test results in Scotland since the start of the outbreak in Wuhan, Hubei Province, China. According to Scottish and UK protocol, all patients presenting with a history and symptoms which may be suggestive of coronavirus will be isolated and appropriate infection prevention and control measures put in place. First Minister Nicola Sturgeon said, "Our first thoughts must be with the patient diagnosed with coronavirus. I wish them a speedy recovery." Scotland is well prepared for a significant outbreak of coronavirus, but there is currently no treatment or vaccine. Early detection measures will continue to be vital in helping to prevent the spread of the virus. People have a vital role to play in helping us contain any outbreak by following the latest health and travel advice, and following basic hygiene precautions, such as washing hands frequently, not touching their face and covering their nose and mouth with a tissue when coughing or sneezing. Scotland's Chief Medical Officer Dr. Catherine Calderwood added, "Scotland is well equipped to deal with infections of this kind. We have a proven track record of dealing with challenging health issues, and have been preparing for this possibility since the beginning of the outbreak in Wuhan. This is peak season for respiratory and flu-like illness. There will be people presenting with symptoms of acute respiratory illness, but these cases are highly unlikely to be coronavirus, COVID-19. We practice and prepare our response to disease outbreaks and follow tried and tested procedures." For more on this story, visit the news article link.